Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30+ lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30+ lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine. This is where we interview the game changers, the visionaries, those who are changing medicine. And today we have the honor of having Dr. Nathan Goodyear. And let me tell you about him. He has been around from the very beginning, literally one of the first people who became certified through A4M. And I know him since probably around 2004, 2006, and he's amazing. And I'll tell you why in 1 second. He's an OBGYN. He is a cancer expert. He's an integrative medicine expert. He is part of the nitric oxide expertise group and vitamin C. And I will ask him to talk about anything he wants to talk about, and then I'll ask. So thank you, Dr. Goodyear.
Erica, so nice to be here.
It's so nice to be with you.
You know, I feel humbled by that introduction because the only way I look at what we do is we're just basically leaning on those that went before us. You know, a good friend of mine, David Zava, I tell him, look, you're the giant. We're just standing on your shoulders. You basically paved the way, and we're just walking through that path that you carved, and we're just carrying it that next mile. And so for me, that's all this is. And you're right, unfortunately, we have been at this a little while.
We're lucky to be alive to still see it actually happen. Tell us about, today you're talking about peptides and you're talking about the new medicine as we're moving forward, but you've been moving it ahead for a long time. Why don't you talk about oncology for a minute?
Yeah, you know,
cancer treatments.
It's interesting. Everything is a journey, is it not?
Yeah.
And so when patients come into our clinics, it's tell us your story. Mm-hmm. And so for me, a part of that journey is my story because actually, interestingly enough, as you get into integrative medicine, often hormones are right there. And so the question of cancer always comes up. What's the connection of my past, of my potential future? And so from that standpoint, cancer always was a part of my practice. And I never advertised, but just more and more patients would come in wanting adjunctive therapies from an integrative perspective to go along with their conventional. But then I was diagnosed with a pheochromocytoma. In fact, I'll never forget, I got a phone call from David, and he said, Nathan, I said, what's up? He said, you okay? I said, I'm fine, why? He said, do you have a pheochromocytoma? I said, funny you mentioned that. Yeah, do you have my test? He said, I sure do. He said, I think you do. And I did. So, but anyways.
How long ago was that?
That was in 2016. That was in
Wow.
2016. So 300 over 130, good old blood pressure, nothing would touch it. And this is where having conventional therapies can be helpful. Okay, the only thing that was going to keep me from stroking was getting that adrenal gland and that mass removed.
Right.
Since then, I've been fine. But at that point, I knew my calling was just cancer. So from that standpoint, I went out to Arizona. But the idea of what we do as physicians, which is healers, we're constantly striving to help the body heal. And it's really interesting that cancer is described as the wound that does not heal.
Which is sad.
It's very sad, but if we get the body healing, which from a conventional standpoint, they don't do a great job of tapping into that process. Chemo, radiation, surgery, those are very destructive processes. And it's really interesting when you look at the way conventional medicine approaches cancer, they approach it from the perspective of your healing goes through the pathway of destruction. I'm like, that doesn't exist in nature.
But it doesn't exist.
Yeah. So the future of medicine is this personalized, precision-based therapy approach, which is multiomics, genomics, epigenomics, transcriptomics, proteomics, metabolomics, I jokingly say whatever omics.
Exactly.
It's just this field of precision, the relationships, the function, understanding the body is a billion pieces working in concert or disconcert together. And so what we want to do in this field of multiomics is bring that precision nature, and of course peptides do just that. They don't obstruct, they don't destroy, they promote function. They promote balance, they promote homeostasis. So my journey has brought me to this point.
That's amazing. Talk to me for a minute about what you're talking about. We call it layering, but you call it stacking of vitamin C.
Yeah, wow. Well, we could spend a lot of time talking about that. Yeah, I know. So,
Just to give an idea, because I think that when we talk about hormones, we have so much to talk about. I think we don't have the time, but I think that what you're talking about is really, you're healing them.
Yeah.
So help them.
I
understand.
heard at an A4M conference actually somebody talking about the symphony of hormones. If you just take one section of the symphony, you get a beautiful sound, but when you bring the pieces together, that's where the symphony just jumps up and jumps out. And so stacking is recognizing that from a cancer perspective, because that's what I do, but understand this applies to every chronic disease of aging. Everybody that comes in with cancer has obesity, diabetes, hypertension, take your pick. And that disease of cancer, whatever the name is, it's not because of one thing.
Correct.
It's not because there was one metabolic issue, one genomic issue, one immunologic issue. It's that all of these came together. Now, a lot of it beget the next, but stacking is recognizing we need to approach it as a dynamic process. Try to almost look at it exponentially, not sequentially, and stacking is bringing these therapies together in sequence and combination in a precise nature.
Which is really important, because I think we're trained to think very narrowly and separate. We don't look at the whole body. In conventional medicine, we're all trained, and you're trained, and MD, I am too. We're trained to think in little pieces, subspecialties. What you're talking about is the whole body, and that's what the stacking you're
what
talking
we're
about.
talking about is a revolution, right?
Right, yes.
Because if you actually look back to the end of the 19th century, there was a gentleman by the name of Christian Smuts. And he was a prime minister from South Africa, a philosopher, educator, and he rejected the compartmentalization of business world education. And he said, we need to understand that the parts only exist to benefit the whole.
Correct.
So he actually brought forth the concept of holism. Now, it wasn't until the mid 20th century, 19th century that 20th century that medicine adopted that holistic principle, but it's recognizing that the parts benefit the whole. And so that's really what it's about.
Right. Unfortunately, the subspecialties that came in the 70s actually destroyed that whole concept, and now we're building it back together. So talk to us about the vitamin C for a minute.
Yeah. So, well, in terms of stacking, vitamin C is a therapy that can be used with a wide variety of therapies. But it's really interesting when you look at vitamin C from just a cancer perspective. It's kind of the flagship of integrative medicine. That's why I talk about it so much, because we must protect and preserve what we do, because it comes under attack, right? But the evidence supports us.
Sure.
The evidence leads the way. And when you look at vitamin C, it's really interesting because the pharmacokinetics, the pharmacodynamics, the bench science around vitamin C supports our use in the treatment of cancer with vitamin C. So, and what's great about vitamin C, it kind of has a dualistic principle in the body, in that it will target cancer cells pharmacokinetically, but it will also not damage healthy cells. And it does this metabolomically. Research has actually shown that vitamin C will create a detoxification crisis through the depletion of reduced glutathione in the cancer cell, but not the healthy cell. It will actually inhibit NAD and thus create an energy crisis in the cancer cell, not the healthy cell. So a natural therapy, when delivered therapeutically to maximize pharmacokinetics, meaning check the blood levels, make sure we're achieving therapeutic levels, get it into the extracellular space, penetrate the tumor microenvironment, penetrate all aspects of the normoxic and hypoxic areas of the tumor. Now you're going to start to see the power of a natural therapy, because it's going to metabolomically impact the cancer in a way that induces its death, but also at the same time, it doesn't hurt healthy cells. In fact, research has shown that vitamin C will actually counter the platelet cancer cell aggregate, which helps to survive, helps to increase the survivability of circulating tumor cells, which favors metastasis. So here's a natural therapy that doesn't harm healthy cells, targets cancer cells, but at the same time helps to protect and prevent against metastasis, which is where 90% of morbidity and mortality comes from. It's like, wow, win, 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 win.
Right. And in conventional medicine, chemotherapy, radiation therapy is non-specific. I mean, it kills cancer cells, but it also kills healthy cells. So
Kills the immune system.
Paulson was, Paulson got a Nobel Prize. They tried to take it away from him. He was right.
It's really interesting when you look at the history of chemotherapy, particularly maximum tolerated dose chemotherapy. It's born out of war.
Right.
Initially, there was the use of chemicals to treat disease.
Right.
Then it was the use of chemicals in war. Then that migrated to the use of chemicals to treat cancer. And that's, if you look at where everybody talks about cancer, go to war on cancer. Well, because it was literally born out of war.
Right.
So that mindset and that destructive process still applies. And when you go to war on cancer, it's not, I jokingly say this, it's not some, bad Sigourney Weaver Alien 25 movie where this was implanted in you. When you go to war on cancer, you're literally going to war on the body.
Exactly.
And so don't be surprised if what you get is massive collateral damage. And that's exactly what you get.
Exactly. And most deaths actually come from the therapies rather than from the cancer itself.
Yeah, if you look at 90% of the reason why patients with cancer have morbidity and mortality,
Right.
it's when cancer spreads.
Right.
The research is very clear. Chemo, radiation, surgery, they will make it spread. Now, that doesn't mean it happens all the time, but they will de facto cause the cancer to spread. So if we shrink a primary tumor, which in breast cancer research, full dose chemotherapy can, but then you set the stage for it to spread.
By cutting it out.
By just chemo.
By just chemo. Then cutting it out.
Yeah, you've cut your nose off to spite your face.
Exactly.
Why, when you look at surgery, and by nature, and my original training was a pelvic floor surgeon.
OB-GYN,
Yes, I
right.
was a pelvic floor surgeon. And going back to those vaginal mesh days, okay? Yeah,
Yes.
that was
That
a
didn't
messy
work
time.
well.
No.
They still do it though.
We created wounds.
Yes.
Okay? And wounds with synthetic materials don't tend to heal well.
don't heal.
So if you have a wound that doesn't heal, that is cancer,
Right.
and then you cut it, why should you
How's that gonna work?
suspect good results?
Right.
Now, sometimes reducing tumor burden is very beneficial, but we have to recognize the context and the purpose of what we're doing. We want to heal.
Solid tumors
Yeah.
and things that actually
We want to heal.
interfere.
We
Right.
want to heal.
Right.
And if we're doing a therapy that confounds that keeps us from being able to reach that potential, we need to change what we're doing. And that's what organizations like A4M do. They are for the curiosity of mind.
Yes.
They are for critical thinkers, not group thinkers.
Right, no. And when you look for, protocols and what you should be following, A4M gives you the whole picture. And it's really amazing. That's why we're here. One more thing. Talk to me about peptides.
Oh, wow, yeah. Peptides are just, they're a fancy word. A lot of people, garner onto them. And of course,
the skin creams, that's how it started, that you put it on your skin.
A lot of anti-aging movement associated with it, hormones. But what we're talking about here, and what I'm talking about here at this meeting, is talking about peptides in a precision-based manner. These are not off-the-shelf peptides. These aren't peptides like TA1, BPC 157, or hormone peptides, anti-aging peptides people might use just off the shelf. That's low quality, high quantity. What we're talking about here is high quality, low quantity. These are peptides created only through testing genomically, transcriptomically, proteomically. These are peptides that don't exist until they're made to match that individual's needs, that individual's healing needs, immunologic needs, molecular needs. And so it is the future of medicine. And that's what is really interesting about it. It's kind of an engineering approach to it, but it's a very precision-based, it's a very healing-based approach, which
and
for me...
And how do you get them? How do you make them?
Well, you have to do testing.
Right.
So you go through 4 different phases, which is the first is discovery. For us in cancer, you do testing of the tumor. You do testing in the blood, you do whole exomic sequencing, you do RNA testing, circulating free, circulating tumor DNA. From that standpoint, then you go into the design phase, and this is looking at molecular functioning, dysfunctioning pathways, immunologic pathways, and then from that pathway, from that design, you then move into manufacturing. These peptides are made for that individual.
Where are they made?
They're made at pharmacies, particular manufacturing pharmacies, and then from that standpoint, they are then given to the patients. They can be given IV, they can be given IM, and we use these as standalone. We use these in conjunction with integrative, holistic, conventional therapies. And actually, I present 2 very short testimonials of patients that were using them in our cancer patients because it allows them to pivot from treatment to healing.
Beautiful.
It allows them to live as they heal. In fact, the first time I heard the CEO talk about this in 2020, it was like one of those, overutilized words, eureka. It's like, this is a therapy that allows us to make that pivot to healing and get the patients living again. And so for us, in these 2 testimonials, very short, they do just that. They talk about one of the patients, she came in a wheelchair, horrible breast cancer, bone mets, liver mets. Now, she's not achieved no evidence of disease just yet, but her large liver tumor, 14 centimeters, down by 76%.
Wow.
Her pain is gone. Her bone mets are essentially gone. She has 2 little hot spots, and she walks on a farm. She has no pain.
How long did it take you to do this?
Well, she came to us in, I think it was April last year. Now, she went through treatment, but literally when she came to us, 2 days later, she was in the hospital because she had a C-spine fracture, pathological. And I can remember calling her husband, and she was in the background screaming because of the pain. And she was in the hospital. And now, when I see her, named Cindy, it's just, she'll kind of give a little pep to show you, hey, I have no pain.
Beautiful.
I walk on my farm. I play with my grandkids. And what she's seeing is healing, and she lives as she heals. So peptides and the precision nature of this allow us not to just play the short game of treatment. They allow us to pivot to the long game of healing, and that fits within that concept of not just the parts, but the whole. Because that's what we want, right? When patients come to us with cancer, whatever named disease, it's not because I want that label removed, it's because they want to be whole.
Right.
They want to be healed.
They don't understand that. They don't know that, but I think they're starting to see it, and I think what you're doing is amazing. And I think you're going there. You're a pioneer, and when you say about David Zava, we all agree David Zava is one of the people who started, one of the pioneers, but you're next in line.
Well, I humbly say thank you, but I look at them because they blaze trails when there was no trail to blaze. I'm just following in suit. But
You're
thank you.
doing a great job.
Well, thank you so much for what you do.
Thank you.
You bet.
Thanks.